Hi, this is Maksud Ahmed Lashkar, Assistant Professor, Faculty of Pharmaceutical Science, Assam Downtown University. So today I'm going to present here the pharmacology of antiseptics. Actually, it includes what is antiseptics and what may be the possible mechanism of action for this and what may be the adverse effect or side effect and in which purpose we can use the antiseptics. So first of all, in introduction part, we have discussed here कि antiseptics or disinfectants are the agents. So these agents, they are sufficiently low toxic to the host cell, but they are strictly meant for causing some toxic effect to the to the substances. I mean to the bacteria, fungus, or maybe some viruses. Actually, they are meant for that. So here we can use these antiseptics directly on the skin or mucous membrane or wound. Actually, sepsis or antisepsis is the use of chemicals to destroy most pathogenic organism on animate surfaces. That means living surfaces, on living surfaces in the sense skin, where we can apply these kinds of drug to destroy the pathogenic organisms like bacteria, fungus, viruses, and all this. So the main importance of this antiseptic is actually that depends on their selective toxicity. That means they should harm the microorganisms, but they should not causing any harmful effect to the human cell or host cell. So next we will see the purposes where we can use these antiseptic drugs. So the first one is for the treatment of skin infection. For example, if there is a fungal or bacterial infection in the skin, in that case we can use this antiseptic on that particular skin. Secondly, that prevention of infectious infections in the cuts and wounds. So whenever there is a cut or wounds, then we find these antiseptics are being using to prevent that sepsis in that particular or infections in that particular cuts or wounds. Then cleaning the skin area of surgery from microorganisms. Obviously, before going for any kinds of surgery, it has been seen that for the cleaning of that particular area, I mean to remove or to avoid the contamination of microorganisms, we can use these antiseptics. Then prophylaxis purpose. So in the treatment of mucosal area, if there is an infection in the mucosal area like mouth, nose, vagina, or some other open to the mucosa that is exposed to the environment. So for those mucosal area, their infection can be treated. Before going for the treatment of the infection, we can take this drug as a prophylaxis. Lastly, as a scrub for surgeon and medical personnel. Then we will see the mechanism of action of these kinds of antiseptics. So here I have categorized the three different point. Okay, the first one, suppose alcohol, phenol, aldehyde, and metallic compounds types of antiseptic. Actually, they follow the mechanism that they denatures the proteins and DNA bases in the bacteria or fungus, or maybe to some extent up to in viruses also. So the second thing is the cationic detergents. So they actually interfere with the plasma membrane permeability in the bacteria, fungus, or maybe viruses, and that will leads to leakage of enzyme and coenzyme along with their metabolites, so which ultimately helpful for the destroying of your microorganisms, maybe bacteria and all. Then lastly, some agents like oxidizing compounds, okay, for example hydrogen peroxide. So they actually oxidize the functional molecules in the organisms. So these are the various mechanisms that they actually follow for causing their antiseptic activity. Then some of drug we will be discussing here. So the first is the halogens. So halogens actually they are the releasing compounds. Okay, so they have most effective antimicrobial activity, as well as they also can be used as an your disinfectants or antiseptics. So iodine and chlorine has found to be more effective uh, antiseptics as compared to bromine and fluorine. And povidone iodine, actually it is a complex of iodine plus polyvinyl pyrrolidone. So this is a surface active agent. So actually it used as antiseptic as well as disinfectants. So they generally kill the vegetative bacteria or mycobacteria, then fungi, lipid containing viruses, and also to some extent they kill the spores. Okay, so if we are using for long period of time. Then next is the alcohols. So alcohols are also used most prominently as an antiseptics. So the first is like ethyl alcohol. So 70% of ethyl alcohol or maybe isopropyl alcohol, these are very effective antiseptics as well as disinfectant agent. So it has found that they are reducing about 90% of bacteria whenever they have been applied to the skin. Then actually they repeatedly kill the vegetative bacteria, fungi or lipophilic viruses. So the process they involved is they will denature the protein and disturb the membrane permeability of the bacteria. And then these alcohols are obviously they are very inflammable, and therefore it should be stored in a cool and well ventilated places. Then or else they can damage or they can cause some I mean they are flammable, so fire incident may occurs. Then they can damage corneal tissue if we are applying them directly to the eyes. So for any kinds of instrument if we are using in eyes, it must be free from alcohol before use. Then we will see the oxidizing agents. So hydrogen peroxide is the most common oxidizing agent that has been found to be used as an antiseptic. So it is mostly effective and in injured skin due to bubbling effect. So this H2O2 or hydrogen peroxide, it's used 3% solution in normal cases as an antiseptic. Then here concentrations actually have some potential towards its antisepsis activity, and it's effective against the vegetative bacteria in higher concentration. They also can act as a sporicidal. Then disinfection of respirators, then plastic eating utensils, then soft contact lenses, carton for milk or juices. So in those cases 10 to 25% concentration is sporicidal. Thank you.